Hi everybody, I'm Dr. Falah Tamimi from Amman, Jordan. I'm consultant psychiatrist. I will talk today about the mental health in COVID-19. This pandemic came suddenly and spontaneously. It makes a tremendous changes in our quality of life, and that it might affect the feelings, thoughts, and our behaviors toward ourselves and others. Social distancing is one of the main preventive precautions against this COVID. But social distancing is not a social isolation. Social distancing is just to protect ourselves, protect others from ourselves, and to make precautions in order not to transmit the disease, because still now social distancing is the only or the main preventive measures meant to prevent the spread of the virus, because still there is no vaccination, no known medication at the time being. Social distancing, as we say, is not social isolation. Also, social isolation does not mean you feel lonely. You can connect, relate, communicate with others, or you can disconnect, not relating, not communicating. You can be alone with social isolation in your house and you are not feeling lonely. And you can be between people and still you feel lonely. So it is an objective and subjective feeling and thinking. Also, people differ in coping to stress. So every individual has his own or her own way to relate to cope with stress. It depends on many factors. Sometimes the stress itself, the meaning of stress to the person, the quality, quantity, the strength of the stress, the environment, the community, the social supporting, the health providing and utilization services, the mental health services, and on the top of that, the person's personality and the way to cope to stress, the coping to stress, the defense mechanisms of the person. So, not everybody will react to the same stress as the other. But in general, in COVID-19, which is a catastrophic pandemic all over the world, most people will share more or less um, different kinds of emotions and thoughts. When we will talk about emotions, we need to talk about worry, feeling unease, anxiety, disappointed, fearful. You know this I look? That means sometimes we are astonished. We don't know what to do. Also, there is many negative thoughts comes to our brain, like I will lose my freedom during the quarantine. I am fearful from this ambiguous unknown disease. I'm afraid that I will catch the disease. What if? What ifs? What if I lose my job? What if I get COVID? What if my family or my friends get COVID? What will be the future? And many of these feelings and thoughts. But the message is most of these feelings, emotions, thoughts are transient and will go by time. Like the COVID, it will go, it will end at the end, and the emotions, thoughts will also fade by the time. our clinical practice, we noticed through over the world, one of the best way to help us as individuals and others through the supportive psychotherapy. There is two ways of supportive psychotherapy. First, formal through the psychotherapist or through the psychiatrist, or non-formal, which is the most common now, through talking to others, relating, communicating, connecting, friends, neighbors, family members, and any other person that you connect. You need to be bi-directional supportive psychotherapy. That means to support yourself, also to support others. Psychotherapy is has some main issues. First, reassurance, explanation, active listening or compassionate listening, empathy, containment, and also you need to when we say a compassionate listening, that means let the other empty his or her heart, and this needs empathy. But empathy alone, if you don't allow them to do it as they want, you will judge them, you will project on them, and this is not good. So don't insult, don't blame, don't project. Listen actively, compassionately, make empathy, connect, contain others, accept others as they are, and to know something. Show your imperfectionisms. We need to relate, and we need to know that nobody is perfect. Expressing emotions is very important. It is not a sign of weakness, it is a sign of strength. Also, the agony and suffering of others must not be judged at all, because they are suffering, because they feel, think, percept the suffering as they are and not as you are. So please be sure that don't judge others. Try to have a compassionate listening. Let them empty their heart, and when you do that, they will feel good and better, and also will feel good and better. Also, you can do this with others. During quarantine and COVID pandemic, we need to put a plan. The plan helps us to feel that we are in control, and it will decrease our fear from losing control, because the main two ideas that worries us is that this is an ambiguous unknown and we are losing control. Second thing is the ideas and feelings about our freedom, because in the quarantine there will be a little bit of social isolation that is not by our choice, but it needs to be dealt with. The plan must consist of many things. First thing, it must consist of the emergency phones of the important persons and facilities, like 911, your doctor, your psychologist, your psychiatrist, and also your neighbors, your friends, your family members, and anybody that you can reach. Second, you need to do a harmony of the quality life domains. You need to put in the plan the way to sleep, the hours, and what to eat, healthy food, sporting. You need to be creative in order to take care of yourself. That means you don't need to go to gym. You can do sporting in house. Also, you need not to change your routine tremendously, except you can replace the routines that you can do in another creative way. For example, if you are at home and you don't go to your school or university, you can study through social media. Also, if you can't go to work, and you can work through social media from home. Also, being in your home, that you and doing your social distancing from your relatives, neighbors, friends, people you love. That does not mean you can't relate. You need to change the way of relating through social media, and you can relate, and you need to relate. Don't isolate yourself, don't disconnect, and don't be lonely. And this can be by talking to your relatives, neighbors, uh, anyone from your family members. Also, we talked about hobbies. You can do your hobbies. You can listen to music, watching TV, watching films, do many things in the daytime. And also, you can share these activities through social media with others. This plan is so important, and it will help you to feel more secure, more safe, and let the anxiety go down. An important message is take care of yourself, support yourself, help yourself through the plan I said before. Then you can support, help, taking care others. Also, after that, you can take the support and taking care from the others. Older people needs to be more elaborated and helped by us. We, the young, we, the students, we, the family members, we, the young neighbors, by volunteering to help them, but also providing of the social distancing. We might call them, we can socialize with them through the social media, eat with them through the social media, our meals, even see TV with them, taking out their trash, bringing food to them, and many activities, but with taking all the preventive measures not to get them exposed to us, because we might give them the virus. Also, we need to just consider that we all have COVID, so we all might give the COVID or take the COVID from the others. There are many things to do during the COVID. From our clinical experience, we are noticing people differ in a variety of their actions. So, what I can advise you is to make what suits you, with taking all the preventive measures that can help you and others to conquer this COVID pandemic. Some people will have this as a catastrophic major stressor, and they might get some mental disorders. They might have panic disorders, obsessive compulsive disorders, phobias about their health of their beloved, phobias about contamination, depression, and some mental illnesses. Our advice, if the symptoms I said before, which most of them will be transient, if they are so intense and they are changing your functioning, they're making your life deteriorating, you need to consult your psychotherapist or your psychiatrist. Nowadays, in no clinics are opened in the private sector. So you can talk to your doctor or psychologist through telepsychiatry, telemedicine. Yes, it will not be a total substitute for talking to your psychiatrist or psychologist face to face, but is an excellent and creative way used in other countries, and also we are using it in Jordan in order to take care of our clients. From our practice, yes, it is beneficial and it can help people to overcome their feelings, thoughts, and also to take advices. Also, if they need medication, the psychiatrist can send them the prescriptions. They can call the pharmacies, and they can get their medication. Many things we can do to cope with the stress of COVID. We need to have this social distancing. We need to relate. We need to put a plan. We need to take care of ourselves and others. And at the end, I wish you all to be safe, secure, and to party after the COVID-19 is over, and to see you as soon as possible. Thank you for your listening.